for you guys all about COVID and the vaccines. We'll be giving a presentation in both English and Spanish, so each slide will be translated.
Do you guys want to record it?
Yes, we are recording.
I'm sorry.
Hola a todos, somos un grupo de alumnos estudiando la salud en San Luis, la Universidad de San Luis, y por una clase de educación interprofesional organizamos una presentación sobre COVID-19 y las vacunas. Esta presentación será en los dos inglés y español, entonces cada diapositiva estará traducida.
Hi, I'm Michaela. I'm a nursing student at St. Louis University, and I'm a senior graduating here in May.
Hi, my name is Maggie, and I'm also a senior in the School of Nursing at St. Louis University, also graduating in May.
Hi, my name is Elizabeth. I'm in my third year studying occupational therapy here at SLU. Hola, me llamo Elizabeth y estoy en mi tercer año estudiando terapia ocupacional aquí en SLU.
Hi, my name's Lauren and I'm a junior studying athletic training here at SLU with a minor in Spanish. Hola, me llamo Lauren, estoy en mi tercer año y estudiando entrenadora atlética con un subespecialización en español.
Hi everyone, I'm Denise. I'm also studying physical therapy in my third year and also Spanish and psychology as well. Me llamo Denise y estudio español, psicología y fisioterapia en SLU.
Hi, my name is Revati. I'm also studying physical therapy with a minor in Spanish, and I'm a junior in SLU. Hola, me llamo Revati. Estoy estudiando la fisioterapia y mi subespecialidad es español y estoy en mi tercer año.
Hi, my name is Divya. I'm also studying physical therapy in Spanish, and I am in my third year at St. Louis University. Hola, me llamo Divya. Estoy estudiando fisioterapia y español y estoy en mi tercer año en la Universidad de San Luis.
All right, so in this presentation, we have 4 parts. The first part is a recap of the COVID-19 guidelines, the precautions we still need to be taking, even if people are getting vaccinated and the cases are going down. The second section is about common myths that have been circulating about the vaccines. And after that, we'll go into part 3, which is about the COVID vaccine specifically. We'll cover how the vaccines work, how you can get them, the effectiveness, and much more. Finally, we'll finish off the presentation with the Q&A session. En esta presentación tenemos 4 partes. Primero vamos a resumir las directrices de COVID que todavía tenemos que seguir aunque se están distribuyendo las vacunas. Segundo, hablaremos de mitos comunes sobre las vacunas. Después, en parte 3, enfocaremos en las vacunas de COVID, cómo funcionan, cómo se puede conseguirla y la eficacia de las vacunas y mucho más. Finalmente, si ustedes tienen preguntas, pueden preguntarnos.
So the World Health Organization actually declared COVID-19 as a pandemic on March 11, 2020, and that is exactly 404 days from today. And so I'm sure it feels like it's been a really long time that we've been in this pandemic. So we just want to share this information, especially through the lens of a little bit of optimism and hopefully that we can start returning to something a little bit that's like normal life pretty soon. Entonces, el coronavirus fue declarado como epidemia el 11 de marzo, hace 404 días, y estoy segura de que todos nosotros lo creemos, aunque parece como mucho más de un año. Ha sido un año muy largo y queremos compartir información para que la pandemia pueda mejorar.
I know most people here probably know the standard COVID precautions since we've been taking them for a year now, over a year. but I just wanted to take this time to reiterate or give some updates, and all this information is from the CDC.
Sabemos que la mayoría de la gente aquí entienden las precauciones, pero quiero reiterar y dar las noticias. Entonces, esta información es directamente de CDC.
Here are some of the most common symptoms that have been associated with COVID-19: a fever over 100 degrees Fahrenheit, a headache, fatigue, nausea, vomiting, or diarrhea, muscle aches, and a loss of smell or taste.
Aquí están algunos de los síntomas más comunes que están asociados con el coronavirus, como fiebre, dolor de cabeza, náuseas, vómito, diarrea, mialgia o dolor de los músculos y pérdidas de olor o gusto.
COVID has been proven to be spread mostly through respiratory droplets between people in close contact. And the CDC says that it is less common for the virus to be spread through contaminated surfaces and even less common for it to be spread through people and animals.
Ha estado probado que COVID se propaga por transmisión por microgotas respiratorias entre gente en contacto cercano. El CDC dice que es menos común que el virus se propague por las superficies contaminadas y que es raro que COVID se propague entre los humanos y los animales.
Now that we know how COVID is spread, what can we do to stop it? It is important to wear a mask that covers your nose and mouth in order to protect yourself and others. Wearing a mask is not a substitute for social distancing, even if you have gotten your vaccine. It is also important to continue to social distance from people you do not live with and avoiding large crowds. And hand hygiene is still the number one way to limit the spread, so continue to wash and sanitize. And finally, it's crucial to get your vaccine whenever it becomes available to you in order to protect yourself and others.
Ahora que sabemos cómo se propaga COVID, ¿qué podemos hacer para detenerlo? Es importante usar una mascarilla que cubre su nariz y boca para protegerse a sí mismo y a los demás. También es importante continuar el distanciamiento social con personas que no viven con usted y evitar las multitudes y espacios interiores mal ventilados. La higiene de las manos es la forma número 1 a limitar la difusión, así que continuar a lavarse las manos o desinfectarlas. Finalmente, es crucial obtener la vacuna cuando esté disponible para usted con el fin de protegerse a sí mismo y a otros del virus.
This is just a graphic listed on the CDC showing the proper way to wear a mask and the different kinds you can utilize. And just because you're socially distancing does not mean that masks are still not recommended. And this is also a reminder to wash your reusable mask regularly to limit the amount of bacteria that grows on them.
Esta es una imagen de CDC que muestra la manera correcta de usar mascarilla y los diferentes tipos. Y si no saben, sitios como el CDC y World Health Organization también dan los recursos en otras lenguas también, como español. Incluso cuando mantienen el distanciamiento social, las mascarillas todavía están recomendadas. Este sirve también para recordarles lavar sus mascarillas reutilizables con regularidad para restringir la cantidad de las bacterias.
Hopefully you guys have not been ill and continue to stay that way, but just in case, I wanted to share what the CDC says you do when you have any symptoms of COVID. It is important to stay home and contact your healthcare provider in order to get tested. While you're home, make sure you social distance away from your family and disinfect any shared surfaces. And call 911 if you're having any serious emergency warning signs like difficulty breathing, chest pain, or chest pressure.
Queremos revisar lo que el CDC recomienda si alguna persona tiene unos síntomas de COVID. Es importante que se quede en casa y contacte a su doctor para recibir una prueba. Mientras está en casa, aísla de su familia y desinfecta las superficies compartidas. Llama al 911 si se experimenta dificultad con respirar o opresión en el pecho. And so for those of you who haven't gotten a COVID test before, you can now easily look up appointments in places like Walgreens and CVS and other places. And a lot of times they offer free testing as well. And so we just wanted to quickly mention the difference between the types of tests that are commonly offered and knowing which one, what the difference is between both of them. Entonces, para los de ustedes que nunca han tomado una prueba de COVID, pueden buscar por internet sitios de pruebas y hacer cita. Muchas veces es gratis, pero es importante que entiendan la diferencia entre las pruebas. So there are PCR tests and rapid tests. The PCR tests are the most accurate tests that we currently have right now. And there's a saliva version and a nasal version, but they have the same amount of accuracy. And so since the rapid tests have a chance of coming back as a false positive, it's usually better off to just wait for the PCR test, since that's the one that's going to have more, you can have more confidence in that one. So hay pruebas de PCR y pruebas rápidas. Las pruebas de PCR son las pruebas más seguras hoy en día. Entonces no vale la pena de también recibir la rápida, y es mejor esperar por los resultados de PCR.
Because we've been living in this pandemic for over a year now, there have been some guidelines released from the CDC regarding new guidelines regarding COVID precautions. First, research has shown that it is not necessary or helpful to wear gloves unless you're taking care of a sick person or while cleaning, like using disinfecting wipes and stuff. So people should not be wearing gloves like going to the grocery stores.
Hay unas nuevas directrices de CDC sobre las precauciones. Primero, no es necesario ni provechoso llevar los guantes a menos que se cuida de una persona enferma o está limpiando.
The CDC also says that once people have been vaccinated, 2 weeks after their final dose, they're able to be around others who have been vaccinated without a mask in their home.
También dice el CDC que las personas vacunadas 2 semanas después de su dosis final pueden juntarse con las otras personas vacunadas sin mascarilla.
And even if you have been vaccinated, it is still important to practice social distancing and wearing a mask while you're in public.
Pero cuando está en público, es necesario que las personas vacunadas todavía mantengan el distanciamiento social y usen las mascarillas.
We're now going to do an anonymous poll testing your knowledge on myths associated with the COVID vaccines. Ahora vamos a tener una prueba anónima sobre los mitos comunes asociados con las vacunas para el COVID-19. Do we want to go to the next slide? Okay. The first myth is that the vaccine causes sterility. This is not true. However, getting COVID can be dangerous for pregnancy. El primer mito es que la vacuna causa esterilidad. Esto no es cierto. Por el contrario, contraer COVID puede ser peligroso para mujeres embarazadas. Another myth is that the vaccine has dangerous side effects. While we do not have the long-term studies on the vaccine, the side effects of the vaccine that have been studied are mild and only last a day or two. Otro mito es que la vacuna tiene efectos secundarios peligrosos. Mientras no hemos estudiado los efectos a largo plazo, los efectos secundarios que hemos estudiado son leves y solo duran un día o 2 días. Some rumors have been spread that the vaccine changes your DNA. This is not true. The vaccine causes you to make proteins to recognize and fight the virus. Hay rumores que la vacuna cambia su ADN. Esto no es cierto. La vacuna ayuda a su cuerpo en producir proteínas para reconocer y combatir el virus. Another misconception is that the vaccine gives you COVID. It does not contain the actual virus. It will not make you test positive for COVID. Otro concepto erróneo es que la vacuna le dé COVID. La vacuna no contiene el virus real y no le dará un resultado positivo en una prueba de detección de COVID. If you already had COVID, it's still recommended that you get vaccinated because reinfection is possible. Si ya ha tenido COVID, todavía es recomendado que se vacune porque una reinfección es posible. Getting the vaccine does not mean you should toss out your mask. The CDC recommends to still wear a mask in public places until we know more about the effectiveness of the vaccine and if vaccinated people can still carry COVID. Finalmente, recibir la vacuna no significa que debe deshacerse de las mascarillas. El CDC recomienda seguir usando una mascarilla en lugares públicos hasta que sepamos más sobre la efectividad de las vacunas y si personas vacunadas aún pueden transmitir COVID.
Now we will go ahead and talk about vaccines. Ahora vamos a hablar de las vacunas.
As of today, 2.1 million people have gotten their first dose of the COVID vaccine, which means that 35% of the population in Missouri have gotten their first dose. A partir de hoy, un poco más de 2 millones de personas han recibido la primera dosis de la vacuna COVID, cual es 35% de la población en Missouri.
Before we talk about the COVID-19 vaccination, I'm going to go through a few reasons to get vaccinated in general. First, viruses can cause illness and can be passed on to those who are not protected by the vaccine. Second, getting vaccinated will keep you healthy. Third, vaccines will not cause the diseases they are designed to prevent. Vaccines contain killed or weakened viruses. Lastly, young and healthy people can get very sick too. Antes de hablar de la vacuna COVID-19, voy a pasar por algunas razones para vacunarse en general. En primer lugar, los virus pueden causar enfermedades y pueden transmitirse a aquellos que no están protegidos por la vacuna. En segundo lugar, vacunarse te mantendrá saludable. En tercer lugar, las vacunas no causaron las enfermedades que están diseñadas para prevenir. Las vacunas contienen virus muertos o debilitados. Por último, los jóvenes y las personas sanas también pueden enfermarse mucho. Ahora vamos a hablar. Now we will talk about the vaccine types. Ahora vamos a hablar de los tipos de vacunas. There are 3 vaccines that are currently approved by the FDA. First is Pfizer. It is an mRNA vaccine that is for ages 16 years and older. Second is Moderna, and it is also an mRNA vaccine for ages 18 years and older. Lastly is Johnson & Johnson, which is a viral vector vaccine for ages 18 years and older. Hay 3 vacunas que están aprobados por el FDA. Primero es la vacuna de Pfizer. Es una vacuna de ARN de mensajero y personas que tienen más de 15 años pueden tomarle. El segundo es Moderna, que es una vacuna de ARN de mensajero también, y es para personas que tienen más de 18 años. Y finalmente, Johnson & Johnson es una vacuna de vector viral y es para personas que tienen más de 18 años. How the vaccine works. ¿Cómo funcionan las vacunas? To begin, the Pfizer and Moderna vaccine are an mRNA vaccine. Messenger RNA is a subtype of RNA. It carries the genetic information copied from DNA. Now, I will go over how the mRNA vaccine works. Para empezar, la vacuna Pfizer y Moderna son las vacunas contra el mRNA. El ARN de messenger es un subtipo de ARN. Lleva la información genética copiada del ADN. Ahora voy a repasar cómo funciona la vacuna contra el ARN de mensajero. First, COVID-19 mRNA vaccines are given in the upper arm muscle. Once mRNA has reached immune cells, the cells use them to make a virus. En primer lugar, las vacunas COVID-19 de ARN de mensajero se administran en el músculo de la parte superior del brazo. Una vez que el ARN de mensajero ha llegado a las células inmunes, las células las utilizan para producir una proteína de virus. Next, our immune system begins building an immune response and makes antibodies like what happens in natural infection against COVID-19. A continuación, nuestro sistema inmunitario comienza a construir una respuesta inmune y produce anticuerpos, como lo que sucede en la infección natural contra el COVID-19. At the end of this process, our bodies have learned how to protect against future infection. The benefit of mRNA vaccines, like all vaccines, is that those vaccinated gain this protection without having to risk the serious consequences of getting sick with COVID-19. En el fin del proceso, nuestros cuerpos han aprendido cómo proteger contra infección futuro. El beneficio de vacunas de ARN de mensajero, como todas vacunas, es que personas vacunadas obtienen protección sin el riesgo de las graves consecuencias de COVID-19. Now we will talk about the viral vector. Vamos a hablar del vector de viral. Lastly, the Johnson & Johnson is a viral vector vaccine. Viral vector is a modified version of a different virus to deliver important instructions to our cells. Por último, Johnson y Johnson es una vacuna vectorial viral. Vector viral es la versión modificada de un virus diferente para entregar instrucciones importantes a nuestras células. First, the vector enters a cell in our body and then produces a harmless piece of the virus that causes COVID-19. This piece is only found on the surface of the virus that causes COVID-19. En primer lugar, el vector entra en una célula en nuestro cuerpo y luego produce una pieza inofensiva del virus que causa COVID-19. Esta pieza solo se encuentra en la superficie del virus que causa COVID-19. Second, our immune system recognizes that the protein doesn't belong there. This triggers our immune system to begin producing antibodies and activating other immune cells to fight off what it thinks is an infection. Siguiente, nuestro sistema inmunológico, que la proteína no va ahí. Esta desencadenan nuestro sistema inmunológico comienza a producir anticuerpos y activar otras células luchan contra lo que piensa es una infección. At the end of the process, our bodies have learned how to protect us against future infections with the virus that causes COVID-19. Al final del proceso, nuestros cuerpos han aprendido a protegerse contra infección en el futuro con el virus que causa COVID-19.
The three vaccines that are being presented each have different efficacy. So what does efficacy mean? So vaccine efficacy is the percentage reduction of disease in a vaccinated group of people compared to an unvaccinated group. Las tres vacunas que tenemos aquí tienen diferentes niveles de efectividad. Y lo que esto significa es la eficacia y la efectividad de una vacuna miden la reducción proporcional de casos entre las personas vacunadas. Pfizer Biotech is 95% effective in preventing COVID-19 after 2 doses. Moderna is 94.1% effective at preventing COVID-19 after 2 doses and stays effective even after 6 months. Lastly, Johnson & Johnson is 66.3% effective at preventing COVID-19 after 1 dose. La vacuna de Pfizer registró una efectividad de 95% en la prevención de casos de COVID-19 confirmados después de 2 dosis y 94.1% para la vacuna de Moderna. También la vacuna de Moderna sigue siendo 90% eficaz contra COVID incluso después de 6 meses. Y finalmente la vacuna de Johnson Johnson registró una efectividad de 66.3% en la prevención de casos de COVID-19 confirmados después de 1 dosis. Unfortunately, the Johnson Johnson vaccine has been paused due to rare blood clots found in a few women. However, more research is being done on the vaccine. In the meantime, the White House COVID-19 response coordinator says that the U.S. will have enough Pfizer and Moderna vaccines for 300 million Americans. Desafortunadamente, la vacuna y de Johnson Johnson se ha detenido porque se encontraron coágulos sanguíneos raros en algunas mujeres. Sin embargo, van a investigar más sobre la vacuna. Mientras tanto, el coordinador de respuesta COVID-19 en la Casa Blanca dice que vamos a tener bastantes vacunas de Pfizer y Moderna para 300 millones de estadounidenses. And if you already got the Johnson & Johnson vaccine, you shouldn't worry too much about the blood clots if you haven't gotten a reaction yet. These blood clots are very rare. And it takes 2 weeks after receiving the 2 doses for your body to build up immunity. And it's also important to note that even though each vaccine has different percentage and efficacy, all of them are very effective in preventing severe disease and hospitalization, which is the main goal of these vaccines. There has also been some research done on how effective the vaccines are against the different variants of the vaccine, and they are effective against the Great Britain variant, but more research is being done on the South African variant. Toma 2 semanas después de recibir las 2 dosis para que el cuerpo desarrolle la inmunidad. Aunque cada vacuna tiene diferentes porcentajes de efectividad, todas estas vacunas son muy eficaces para prevenir enfermedades graves y detener la propagación de la enfermedad. Todas estas vacunas son efectivas para prevenir las diferentes variantes, especialmente de la Gran Bretaña. La variante Sudáfrica todavía está en revisión. Sí. Next slide.
Okay, so originally I was going to talk about the different phases and tiers of the vaccine, but as of April 9th, Missouri has entered phase 3, so anyone who wants to get the vaccine is able to. However, it's still good to know your phase loosely because you can qualify for if you qualified for an earlier phase, you potentially have higher priority than those in phase 3. Originalmente planeaba hablar de las fases y las gradas de la vacuna en Missouri, pero desde 9 de abril, Missouri ingresó en fase 3 y cualquier persona que quiere obtener la vacuna puede. Como es una buena idea saber su fase porque si cualifica para una fase anterior, usted podría tener mayor prioridad que los de la fase 3. So phase 1 is healthcare workers, long-term. Phase 3 is kind of emergency services. Fase 1 es los trabajadores sanitarios o empleados de cuidado prolongado. y servicios de emergencia y personas con alto riesgo como diabetes y presión alta. Phase 2 is more commercial facilities, workers, higher education, and those types. Fase 2 es instalaciones comerciales, educación superior y personas sin hogar. And phase 3 is any and all remaining Missouri residents, which is what we are in right now. Fase 3 es todos y cada uno de los residentes de Missouri. And it's important to know if you missed your phase or tier, you can still get the vaccine. It's never too late to get the vaccine. Si se perdió su fase o grado, todavía puede obtener la vacuna. Nunca es demasiado tarde a recibir una vacuna.
Okay, and these are where you can get your vaccine. So since April 9th, all people above the age of 16 can easily find access to a vaccine site in the St. Louis area. That is for Pfizer, as we heard. So from Moderna and Johnson & Johnson is 18 and older. But since then, access to these vaccines is actually a lot easier than you would think. Listed below is a complete list of the hospitals and their vaccine clinics to access a vaccine nearest to you.
Desde 9 de abril, todos los que tienen más de 16 años pueden encontrar acceso a un sitio de vacunas fácilmente en el área de San Luis. Acceder a las vacunas es más fácil de lo que cree. A continuación se mencionan una lista completa de hospitales y clínicas de vacunas.
Okay, so those were all the sites. I'm going to go through and so I chose Mercy Hospital as the vaccination site from the sheet that is closest, that is closest to you. And I'm going to show you how to get a vaccine appointment. So first you would click Missouri vaccinations and then choose the site nearest to you.
Este es un ejemplo de un sitio y ahora voy a mostrarles cómo pueden pedir una cita para la vacuna. Primero, clic Missouri Vaccinations y lugar más cerca a ustedes.
Once the site is selected, you're going to click schedule an appointment, and then there will be pre-survey questions that will appear. It's important to note that the pre-survey questions is just to see if you are eligible and if there are enough vaccine available in that area for you. If there are no more available, please click one of the following links listed before and continue the process until availability is higher in that area in order for you to make an appointment for your vaccine.
Una vez seleccionado un sitio, haga clic en programar y sitiar y aparecerá la pregunta previa a la encuesta. Es importante notar que el pre-encuesta es para ver si está elegible y si hay bastantes vacunas disponibles en ese área. Si no hay vacunas disponibles en este área, por favor haga clic en uno de los siguientes enlaces debajo y continuar el proceso hasta que haya más disponibilidad y puede pedir una cita.
So next, I just want to talk about some of the concerns that people have about their rights to a vaccine or access to it, depending on their documentation, whether or not they're a permanent resident of the U.S. or if they don't have health insurance. This is a reason why a lot of people can feel hesitant to receive the vaccine. So we just want to clarify some information. Entonces quiero clarificar un tema del que muchas personas se preocupan. En los Estados Unidos, todo el mundo tiene el derecho de recibir la vacuna cuando sea elegible. No es necesario presentar documentación ni seguro de salud. So next slide. So just to further support the idea that everyone in the U.S. has access to vaccines, whether or not they're an undocumented immigrant, whether or not they can pay for it, everyone in the United States has access to a vaccine and has the right to receive it. And so in support of this, the Department of Homeland Security released this statement that shows how they fully support equal access to the vaccines, specifically for undocumented immigrants. and that it's a moral and public health imperative that everyone is able to receive the vaccine regardless of their immigration status. So next slide. El Departamento de Seguridad Nacional ha dado una declaración sobre el acceso a las vacunas para los inmigrantes indocumentados. Dice su apoyo para las vacunas para los inmigrantes indocumentados y dice que es un imperativo moral y de salud pública y que es muy importante que todo el mundo reciba la vacuna. And on the next slide, this is just a couple more of the rights that everyone has to the vaccines. And so it's really important that we remember these because we know sometimes that the vaccine rollout process can be a little bit messy and not everything is communicated from the government down to us in a very clear way. So we just want to clear up some of the things that some people might be having concerns about. Aquí tenemos unos derechos que todas las personas tienen en relación a las vacunas, porque sabemos que es difícil entender toda la información del gobierno federal. Y sí. So first of all, it's not a public charge receiving the vaccine, unlike other healthcare services that cannot bar you from being a permanent resident. You are protected from that, and going to the vaccine isn't the same thing as showing up at the ER or something like that. So, no es cargo público, a diferencia de otros servicios de salud. Recibir la vacuna no impide ser residente permanente. And so next, the vaccine is also free of charge. It's completely paid for by the federal government, also to increase access for everyone. Es completamente gratis la vacuna. No tiene que pagar ningún precio porque las vacunas están pagadas por el gobierno federal. And in case you didn't know, there's a law that was passed last year that covers COVID-19 tests, but now also access to the vaccine for people who don't have insurance. So it won't be an issue when you show up and you don't have to present an insurance card or anything. Por si no saben, hay una ley que se llama the CARES Act que da acceso a la vacuna y las pruebas de COVID si alguna persona no tiene segura salud. And finally, all of the information that you provide if you're checking into an appointment to receive the vaccine or just to get a test can't be shared with any other department of the government. It's all protected under HIPAA. So, por fin, su información de salud es protegida. Si provee alguna información o identificación cuando reciba la vacuna, no puede compartir su información ni usarla por otros propósitos. And on the next slide, so just to finish up this section, I wanted to show this graph that shows the percentage of each race or ethnicity group in the US that has received at least the first dose of the vaccine. And the red bar shows exactly what I said, the percentage that received the vaccine, but then the shadow that's underneath the gray bar shows the percentage that they actually represent in the US. So you can see that a greater percentage of the white non-Hispanic population in the US has received a vaccine, which disproportionately is related to the percentage that they have. And then if we compare this to the Hispanic and Latinx and Black non-Hispanic populations, these numbers are a lot more underrepresented of the numbers that we have. And this can cause a lot of issues, especially because people of color are more likely to be working the essential jobs that can't stay home from work. And so they're at higher risk. So it's important that all of them have access to the vaccines to protect themselves, as they are one of the most vulnerable populations right now. So para concluir esta sección, esta gráfica muestra el porcentaje de los grupos de etnicidad o raza que recibió la primera dosis de vacuna. Este es en el rojo, y el gris muestra la población de este grupo en este país. Podemos ver que la representación de la población blanca es más que su porcentaje actual del país, y por otro lado, los individuos latinos y negros son subrepresentados. Esto demuestra que menos de estas poblaciones han recibido la vacuna. Este puede ser por los obstáculos, pero es muy importante que todo el mundo reciba una forma de protección para terminar la pandemia, especialmente cuando los trabajadores esenciales están muy vulnerables al virus y es una población con mucha gente de color.
Now that we know how the vaccines work and how we can get the vaccines, let's talk about what the symptoms of the vaccine are. Ahora sabemos cómo las vacunas funcionan y cómo podemos conseguirla. Vamos a hablar sobre los síntomas de la vacuna. But before we start, let's see how many people have gotten the vaccine so far. So I'm going to just put a poll and let's just see how many people have gotten vaccinated. All the responses are anonymous. Todas las respuestas son anónimas. So a lot of you have already gotten the vaccine. Some of you are still deciding, but hopefully you'll change your mind by the end of this presentation. So at the injection site, you'll experience some redness, swelling, pain, and soreness. And to remedy that, you can apply a clean, cool, wet cloth over the injection site. Also, move your arm around often to help with soreness. En lugar de inyección, sentirá dolor, especialmente dolor muscular. También verá enrojecimiento y inflamación. Para remediar estos síntomas, pueden aplicar un paño limpio, fresco y mojado sobre el lugar de inyección y también mover el brazo. Throughout the rest of the body, you'll feel fatigue, headache, nausea, fever, chills, muscle pain. And to remedy this, you should drink a lot of water, dress lightly, and rest like you would do for a fever or a cold. En el resto del cuerpo tendrá fatiga, dolor de cabeza, náuseas, fiebre, escalofríos y dolor muscular. Para remediar estos síntomas deben beber mucho agua, ponle algo liviano si tiene color y descansar mucho. You should not take ibuprofen, Tylenol, aspirin, or any antihistamines before the vaccines to prevent the side effects, but you can take it afterwards if that's something that you are normally able to take and doesn't affect any of the other medications that you take. No debe tomar analgésicos como ibuprofen, Tylenol, Advil ni Benadryl, que es un antihistamine, antes de la vacuna para prevenir los síntomas. Sin embargo, puede tomarlo después si por lo general toma. If you have any questions, you should definitely ask your doctors about which painkillers you'll be able to take. Si tiene dudas, puede preguntar a su médico, especialmente si tomas otras medicinas y no sabe si puede tomar analgésicos. You should call your doctor if the redness or tenderness of your injection site gets worse after 24 hours. If any of the other symptoms don't go away after a couple hours or seem to be getting worse. And if you feel like you're having a severe reaction, you should call 911 immediately or seek immediate care. Si los síntomas no desaparecen o empeoran después de 24 años, llame a su médico y si cree que tiene una reacción alérgica grave, llame 911 o buscar atención médica inmediata. These symptoms may sound scary, but this shouldn't stop you from getting the vaccine. These are just signs that your body is building immunity, so you could later fight the virus if you do come in contact with it. And they're also very temporary. They shouldn't last more than a day, or maybe a couple of days for the arm soreness. Estos síntomas pueden causar temor, pero no debería impedirle conseguir la vacuna. Estos síntomas son señales que su sistema inmune está funcionando para desarrollar la inmunidad contra el virus. All right, now we're going to have a question and answer session. So do you guys have any questions for us? ¿Alguien tiene preguntas?
Puedes hacer
Buenas-
preguntas en el chat también. Lo
Yo.
siento.
Oh. ¿Tienen algunos lugares y fechas donde estén dando la vacuna gratuita?
¿Puede repetir la última parte? No, oye.
Ok. Lugar o fecha donde estén dando la vacuna gratis.
Maggie, she's asking if are there places where they're giving the vaccines for free?
Yes. All of the vaccine places are for free. Any of the locations that I put on the list are free vaccination sites. I can also give that. Eileen has the list and she can give that to you. I also know at LifeWise, they're doing them for free today, and there's also a schedule on that list of when they're also free and in the future.
Todos los lugares son gratis y también sabe LifeWise tiene vacunas para gratis, pero todos son sin insurance o dinero. Todo gratis.
Ella también dijo que LifeWise tiene vacunas y tenemos una lista con todas las sitios que tienen vacunas y vamos a mandarlo a Eileen y ella puede compartir la lista con ustedes.
Perfecto, gracias.
De nada. Karen.
Sí, mi pregunta es, después de vacunarse, entiendo que hay un tiempo que uno debe continuar usando mascarilla y cuidándose. ¿Ese tiempo debe tratar de no salir de casa o uno hace su rutina normal? Esa es una. Y dos, después de la vacuna, ¿se puede tomar vitamina C, vitaminas o es preferible esperar a que no tenga uno reacciones? Gracias.
De nada. So she asked, the first question was, I think after you get the vaccine, do you have to wait a certain time where you should stay in the house or can you continue with your daily routine?
You can continue with your daily routine. It's recommended that you rest for a few days afterwards so that your body, as the vaccine is setting in, you're not going, out and just like wearing more down on your body. And also to your second question, yes, it is good to take vitamin C. It's not something that's like fully recommended by the CDC, but I always say it's a good thing to do for your body.
I would also say you don't have to take off work or anything though after you get your vaccine. Like you're able to like go to work the next day and everything unless you have severe symptoms.
Sí, ella dijo que no tiene que, puede continuar su rutina diaria o cotidiana y si toma vitamina C o otras medicinas, sí se puede tomar los.
Gracias. Disculpe, yo tengo una pregunta. Mi pregunta es, si ya se vacunaron y tienen reacción a la vacuna de que tienen síntomas de fiebre, que le duele los huesos, como dolor del cuerpo, ¿pueden tomar medicamento o no puede uno tomar medicamento como Tylenol, ibuprofen, o uno tiene que esperar a que solo se quite los síntomas?
Yeah, so her question was, can you take medicine after receiving the vaccine if you're feeling bad? And the answer is yes, as long as it doesn't interfere with any medicine that you are already taking, or if you can normally take Tylenol, you can take it after. It's just the issue is people don't want you taking it before. Puede tomar medicina para sus síntomas, es bien. Si tiene un medicamentos que son contra medicación no puede tomar, pero en general es bien y es solamente para su cuerpo y que piensa que toma que pienso es buen para ti.
Y si tiene
Okay.
duda, puede preguntar su médico.
Ok, gracias.
Someone had a question in the chat asking about if we will have to get revaccinated after 6 months, even if you already got your first vaccine.
So currently, I know that we're coming up on 6 months past for the first set of people in the US who are getting their vaccine. So this is something that the CDC is actively trying to figure out whether or not we're going to continue to need booster shots. So unfortunately, that's something that we don't know right now, but at least we know that there are people ahead of us who, where they'll have to figure it out. And by the time it comes for the 6 months post date for the rest of us, we should have some pretty good evidence about what we should do then. So, entonces, el primer grupo de personas que reciben la vacuna en diciembre es casi 6 meses después de su dosis final, y entonces vamos a escuchar unas noticias pronto de CDC sobre las vacunas más que necesitamos.
Una pregunta en el chat is if I'm breastfeeding, but I want to get the vaccine. So si estoy amamentado, sí puede recibir la vacuna si embarazada también.
Zara tiene una pregunta. I mean, Zara, you have a question?
Yeah, I have a question. My question is the kids vaccine. So would they be able to get them with can we get them as a family, or it's going to be like one at a time? And how is that going to affect the person that's vaccinated?
Yeah, so I think so far we've only received FDA approval for the vaccines for 18 plus or 16 plus, depending on which vaccine it is. So we don't have enough data so far because I know that they prioritized the age group of adults because that's easier for them to test on versus testing on kids. So that's something that they're continuing to test, but it won't be available for them until we hear further from the FDA that they've approved it for the people under 18. Su pregunta fue sobre las vacunas para los niños y las personas con años menos de 18, y no sabemos porque el FDA no ha aprobado las vacunas para los niños, pero espero que escuche pronto.
I have one more. Sorry about it. Who was next? The Johnson and Johnson with the blood clotting, is it in Europe only, or did we find it in the United States as well?
So for the clotting, it's like a couple of women have experienced blood clotting after getting the vaccine within like 3 weeks. And so then because of safety regulations, they discontinued it in Europe and here to just review it and to make sure it's safe. And I think, and then what Denise put in the chat before is that in Europe, they decided that it's safe and they recontinued it.
Thank you.
Thank you. I think I have time for maybe one more question.
There was some in the chat. Eileen C asked, after how many days should people with COVID-19 wait to get vaccinated? Después de cuántos días debe las personas que ya infectado con COVID-19 espera después, or no, antes de vacunarse? And if I'm correct, I believe it's 3 months is what people are saying, because you should still have some degree of protection from your body having to handle COVID before. And so I've at least heard anecdotally from people who are waiting the full 3 months so that they can maximize the amount of protection that they'll have from the vaccine afterwards. So muchas personas y médicos dicen que después de 3 meses de infección de COVID-19 puede vacunarse para aprovecharse del tiempo de protección de la inmunidad y también la vacuna.
Eileen also asked, can we get sick after being vaccinated? Ella preguntó, ¿puede estar enfermo si después de vacunarse? The answer is yes, but it's not from COVID. It's from your body's immune response to the vaccine. So just like if you would get any other vaccine, your body is starting to recognize the blueprint or the message and fighting that. This is building immunity, but it shouldn't last more than it did.
It's important to note that it's not COVID itself. You're not actually getting like the COVID sickness. You're just getting symptoms of your body just taking in the vaccine and trying to get used.
Sí, la enfermedad después de la vacuna no es el virus de COVID, es síntomas de la vacuna y no es COVID específicamente. Magda tiene una pregunta.
Sí, por favor, gracias. Para las personas que podríamos en un futuro acceder a la vacuna Johnson Johnson, ¿podrían por favor explicarnos cuál es la reacción que la vacuna esta ha tenido en estas 6 personas? ¿Cuál es el nombre y cómo sabríamos cómo identificarlo? ¿Qué síntomas se tienen para los que podríamos poner o accedernos a esta vacuna en el futuro y poder reconocerlo? Gracias.
So her question was for the 6 people, the 6 women who were found to have blood clots with Johnson & Johnson, what should the reaction be that people are looking out for? I don't know if maybe Maggie or someone else knows this one.
Yeah, of course. So with a blood clot, you would usually have like, so let's just say it's in your calf. You would have unilateral calf pain. It'll be red, warm to the touch, painful when you're just like standing there. So you would notice it. Usually you will catch it like in the calves first or in the leg, but it's usually on one side of your body. That's how you know the difference, if that answers the question.
I think if you think that you have a clot, it's probably a good time to call your provider and go check in with them as well.
Respuesta es dolor unilateral, como solamente un lado del cuerpo y es cálido el tacho y es en las piernas mejormente. es dolor en general y calidad.
Okay, I think we'll go to the next slide. So thank you so much for joining us in our presentation. If you don't mind, I'm gonna put some links into the chat of a post survey. This is just to help us record, get some feedback from you guys about how well we did on our presentation so we can use it for our class. So if you guys don't mind, we would love it if you guys can.
Si hay más preguntas en esta encuesta después, puede hacer sus preguntas y daremos nuestras respuestas a Eileen Wolfington y Eileen puede contactar ustedes con las respuestas.
So I'll also send these forms to Eileen so she can send it out to you guys. And yeah, so voy a mandar estas encuestas a Eileen para mandarles. Y sí, está bien.